In the United States alone, there are over 180 drug-related deaths a day. Opioids are involved in 2/3 of those deaths. Research has uncovered effective treatments for many forms of substance use disorder, but the disease itself is still often misunderstood. People with SUD face stigma on many fronts, from themselves, their loved ones, and even their medical providers. Many people don't understand the nature of addiction and see it as a personal choice or failing. They think, why don't you just choose to stop? In reality, there are neurological aspects of addiction that make it very hard to quit, and the stigma these patients face can make it even harder. As a clinician, ask yourself, do I treat patients with SUD differently than other patients? Do I find patients with opioid addiction less trustworthy than other patients? Do I think SUD is a weakness or character flaw? Research shows that clinicians do often have biases against patients with addiction. Some are reluctant to treat these patients because they see them as dishonest, unlikely to recover, or bad for business. Those who do see these patients may still treat them unfairly or look down on them for their addiction. When patients feel stigmatized, they may not trust that their clinician has their best interests at heart. As a result, they may avoid seeking treatment, or they may disregard clinician recommendations and experience worse outcomes. They may even avoid treatment for unrelated medical conditions for fear of being discriminated against because of their addiction. Stigma can make a person feel afraid, rejected, ashamed, isolated, and even suicidal. So how can you, as a clinician, be part of the solution? There are a few simple steps to becoming an advocate for patients with SUD. 1. Use clinically accurate terminology as you would with any other health condition. For example, abuse is not a diagnosis, and it has unclear meaning. Say substance use, or for prescription medications, misuse instead. Say people with addiction or substance use disorder instead of addict. Discuss drug test results as detected or undetected instead of dirty or clean. Use this language when talking to the patient, talking about the patient with other clinicians, and when documenting in medical records. 2. Educate yourself. Take the time to learn more about SUD and addiction. Learn about the disease and the most effective ways to treat it based on the best available scientific evidence like that from clinical trials. Apply for your DEA-X waiver to prescribe buprenorphine to treat opioid use disorder. 3. Speak up and speak out. Talk with your peers when you observe them using inaccurate, stigmatizing language. Encourage others in your practice to take a patient-centered and non-stigmatizing approach to SUD. Make sure your patients know you respect them as people. Clinicians are at the front line in the fight against SUD and overdose deaths. Do your part to eliminate addiction-related stigma in the medical profession. Lives depend on it.